Hey everybody, and welcome back to the channel. Today's video, I'm going to be talking about weight loss since we're coming up into those summer months, and I know that this is a huge topic that a lot of people really struggle with. And so I wanted to help you all address this and give you some of my tips for when it comes to weight loss. Now, when I was younger, I weighed almost 200 pounds at the age of 12, and that's as much as I weigh today at 34 years old. And this is a very, sensitive topic for me because I want to try to help, kids and family members understand why they're having this weight gain and how you can combat it, because it's not always as easy as you think. It's not always just a caloric deficit. It's not always just a thyroid issue. So let's dive in today and talk about what you can do, some things that you need to check before you start doing any type of crazy diet. So if you want to know a little bit more about me, my name is Dr. Todd Strong. I've been an alternative healthcare practitioner for the last 7 years. Been helping people a lot with neuropathy, as you can see in my channel, weight loss, autoimmune issues, and it's just a really big passion of mine, and I want to help educate more people about these topics so that you can make the best decision possible. So if you're tired of, just a medication, I know Ozempic and a lot of these other drugs are really big right now when it comes to weight loss, but there are a lot of issues that come from using those medications. I see people who have muscle wasting. They're actually losing more muscle mass than they are fat tissue. And weight loss, you want it to be the right thing. You don't want to have muscle loss. You don't want it to make you weaker. You don't want to have atrophy from this, because even though you may be losing weight, it may not necessarily be good weight. And that's some of the bad things that I see happening. So with this, if you've been struggling with weight loss, especially if you do a diet for a short amount of time, you have certain discipline, but then you end up gaining the weight back, if you've had a gastric bypass surgery or something like that, and the weight has come back after that, then there's usually something else going on. This is why you really want to take a deep dive looking at, do we have any yeast or candida infections? That's a big one. I have some videos in my on my channel where we really talk about this, and this is one of the biggest proponents that I see with a lot of patients that struggle with weight loss. Candida is a biomorphic organic yeast and fungus, and what it does, it makes you crave sugar because that's what it feeds off of. And your gut microbiome, if you have this candida overgrowth, it's kind of like having little children that are always saying that they want candy, and you finally just give in. So if you never address the underlying issue, you're going to gain that weight back. So I don't want to dive too much into candida, but this is something, if you have a white coated tongue, so you can see it's called thrush on your tongue, you can just stick it out, take a picture. Another test that we do is we have you spit in a glass, and if you see that it has little strings on it or it becomes really cloudy, first thing in the morning, before you drink or eat anything, is when you want to do this, and you let it sit for 15 minutes. That could indicate that you have candida. Another way is if you have chronic antibiotic use, if you have itchy genitals, rashes on your skin, itchy anus can be another sign that you have it. Foggy or brain fog can be another issue with this that can indicate that you may have this issue. So you have to address that underlying issue, and we find that a lot of people, they don't do a proper kill off of the candida, and so it ends up coming right back. Another issue is that I see people do crash diets where they may starve themselves, they may be doing intermittent fasting, and what they'll do is they'll mess up their hormonal system, and this is really prevalent, especially in women, is that you will undereat, and then what will happen is it will actually slow down your metabolism. When you talk about caloric deficit diets, you're not talking about that you're doing these huge deficits where it's 500 to 1,000 calories or 2,000 calories. You want to stick in anywhere in between 200 to 400 calories. That is going to give you enough of your micronutrients, your vitamins and minerals, so that you don't develop these deficiencies which lead to thyroid issues and hormonal issues later down the road. That's one of the biggest mistakes that I see, is that you'll do too much of a deficit too fast and your body goes into a shock and a starvation mode. And you'll see people typically going towards a hypothyroidism in their lab work, where their TSH is starting to increase. And that's just a really big issue eventually down the road. You can end up with hair loss, brittle hair, and you can feel real sluggish. That can lead to brain fog. And to address that, then you're really having to go back and you're having to do a bunch of supplementation to re-spark that thyroid to get it working again, and to kind of get your body out of that starvation mode. So some tips and tricks when you're doing these, if you are going to do like a huge caloric deficit, you have to do something like essential amino acids, so that your body is still getting the bare bones minimum of what it needs to repair, to heal, to produce neurotransmitters, to produce your hormones. That is probably my biggest tip that I tell most of my patients, is that we still need to get you some essential amino acids if you do want to try to lose this weight really fast. The other issue is that most people want the result like then, and I totally understand. But if you can be more patient, if you can lengthen this out to 6, 9, or 12 months, you're going to be a lot more successful with your weight loss. Typically, I do a gut reset with those patients so that it gets out any of that bacteria that causes them to crave sugar. It can really help with reestablishing their immune system and their neurotransmitter production, such as dopamine and serotonin, which are huge when it comes to, helping regulate mood, but also these cycles of, feeling hungry and feeling like you're starving, and or you need to eat to make yourself feel happy. That's really important when you're talking about serotonin and dopamine production. Typically that takes about 3 to 5 months, depending on how severe it is. It can take longer, if you're having a lot of digestive issues such as heartburn, chronic constipation, diarrhea. If it's alternating between constipation and diarrhea, that's another huge issue. And then, if you have abdominal cramping, you should be going to the bathroom at least once a day. I know a lot of people talk about that there are, they have different philosophies. It's okay if you only go to the bathroom, every 2 days or something like that. I don't like that, because you're not moving toxins out of your body. And if you hold on to toxins in your body, what's going to happen is you're going to hold on to more water. More water is going to make your weight go up. You're going to go through this whole cycle that you're not losing weight. And it just, more of it, I would say 80% of this is more of a mental game, more than it is doing the specific diet, doing, the specific supplements, doing the specific protocol. You really have to be able to, think through this. And I think that's where working with somebody comes into benefit. And of course, you're more than welcome to always reach out to me with, any questions that you have, or if there's anything that I can help you all with, just comment below. And, if you know anybody that's struggling, share this video with them. And I want this to be more of an open discussion, because I don't think that I am always right. I think that there can be certain factors that maybe I'm not taking into account. But for 80% of the patients that I see that are struggling with weight loss, I think these principles really help give them a good foundation on what they need to do as far as getting, 20, 30 pounds off that initial weight. And then maintaining it can be the hardest part. And I think you need to have a super good plan moving forward, and allowing yourself not to veer off track. If you have any increase in antibiotic use, that can make you more susceptible to candida again, so having a proper game plan for that when that comes about. But I don't want this video to go on too long. Like I said, if you have any questions, just comment below. But hopefully this helps. And then my biggest tip is that when you finish dinner, what I want you to do is brush your teeth. And in order for you to avoid late night snacking, you'll have to brush your teeth again. But typically that is a routine that's set in your brain that once you brush your teeth, you're done eating. So brush your teeth and then, just go to bed. And that is something that serves as a cue for a lot of my patients who struggle with late night snacking to help them get over that. So hopefully all this helps. Let me know if you have any questions, and talk soon. Bye.